Welcome back to Ozarks Fox AM. It is time for some health news with Kaylee Custer. Kaylee, how's it going?
It's going well. The coronavirus, though, is spreading in the U.S. during cold and flu season, and many are left wondering what the differences are. Health professionals outline and compare the symptoms of coronavirus and the flu and let you know how to spot the differences.
Like a heavier cough, they're actually having the shortness of breath just from maybe like walking here to the door, they get short of breath.
The heavy cough, shortness of breath, and other flu-like symptoms. This is what you need to look for if you suspect having the coronavirus. Right now, COVID-19 is the reason travel has been suspended, major events canceled, and people are staying home. Doctors say these are smart moves in order to stop the rapid spread.
I would say, like, if you keep your hands washed, make sure that, you stay away from anyone that is sick, running a fever. If you yourself are running a fever or sick, stay at home, don't go out.
In Missouri, there have been multiple confirmed cases of coronavirus.
And with fever and cough.
However, Crystal Lane is a nurse practitioner at the Better Med in Charlotte, North Carolina. She says work has been busy with teaching people differences in flu and coronavirus.
With the flu, what we've seen so far are patients present with like high fevers, body aches, chills. Sometimes they have coughing, sometimes they don't, sometimes they have sore throat, sometimes they don't. But the coronavirus seems to be more attacking like the respiratory system.
Healthcare workers are also taking precautions, wearing masks and keeping hand sanitizer nearby.
So that's the main difference, is just the respiratory. If you're walking a short distance and you're having trouble breathing, that's where you would call your doctor.
Yeah.
So you still might experience flu-like symptoms.
All right. Yeah.
Okay.
But the respiratory difficulties
that's the main thing.
Is the main key. Like, hey, I need to get this checked out.
Yeah, and that's not something you notice with the flu too much.
Right. Yeah, I would have thought feeling, body aches,
right,
the cough, maybe just feeling run down.
Yeah.
Yeah.
Not necessarily so.
Yeah.
Right. Like I said, it's mainly just respiratory stuff. So.
But what if an interesting, Kelly, remember yesterday, Kaylee was telling us about Idris Elba, who had no symptoms, but tested positive.
But maybe he just got exposed and before he even felt anything.
And not everyone,
he was around someone.
Not everyone experiences symptoms either. Some are just carriers.
Oh, some are just carriers or never get sick?
Yeah.
That is so weird, isn't it?
I think we find that a lot in children and younger adults.
That they're carriers?
Yeah.
Oh, wow.
And they don't get it. That is so interesting. Yeah.
Yeah, it's just fascinating to me what, this one is,
Yeah.
why it's baffled doctors, because a lot of the treatments that I've seen them say is like, okay, you're quarantined, but there's no treatment really. Like, what do? You just rest at home, drink lots of water,
I would say so. I mean, get your veggies in, do normal stuff that all these health professionals have been telling us for several decades. Eat good, clean food. Drink your water and exercise. Sweat a little bit if you can, if you're up to it.
Is that a good thing to sweat, would you say?
I would say it's always a good idea to sweat.
Endorphins.
But right now at home, because the gyms are closed. So if you can, but also get some extra vitamin C. None of us get enough vitamin C. If you can buy the little packages, that will help really to stay well in this flu season.
Elderberry and other sort of essential oils might be good to just have in the air.
Yeah.
They might open your airways a little bit.
And by the way, Kaylee, tomorrow my doctor will be on the show answering our questions. We're going to post on our social media after the show. If you have any questions, we will read those to the doctor tomorrow and have him ask your questions about COVID-19. I thought it'd be great for all of us to be a part of that.
I agree.
We all have questions, so we could ask him.
Yeah, I agree. That'll really clarify things a little bit better for us.
Thanks, Kaylee.
All right, Kaylee, we appreciate it. Yes.
All right, more fun on Ozarks Fox AM right after this. We're playing a brand new game.
I know.
I'm excited.